Good morning.
Good morning, Dr. Simmons. How are you?
I'm doing well. How are you?
I'm doing well. So I was reaching out. Well, first, let me introduce myself. My name is Amir Towns. My company is Towns Advisory Group. Towns Lending, doing business as Towns Advisory Group, just because we do more than lending.
Hmm.
But I offer working capital to small business owners. I started out just helping people in the healthcare field and kind of branched off from there. Well, small business owners in the healthcare field and branched off from there.
Okay.
And I'm getting back to the basics and just wanted to connect with small business owners like yourself and see kind of do some market research and see kind of what are some of you guys' pain points. Why'd you get into the business, how you got to where you are now, how long you've been in the business, um, and to see how gather information so I know how I can better serve my clients.
Okay.
And so, yeah, I'd like to hear more about you.
So I'm a medical professional. I started off in 1996
Wow.
and been in radiology the entire time. And then in 2013, while I was doing a case, I realized that the products that we have was not working for what we needed for.
Okay.
At that point, I went and did some research and couldn't find another product that would work for our procedures. So I decided to come up with my own product. So at that point, I drew some images, came up with my concept, took it to the animal lab, did my own research, came up with a design, and then took that design to a small boutique engineering firm, made me a true prototype. And
Okay.
then that prototype I took back to the lab and tested it again to make sure that it does work the way I want it to work. And it did. So at that point, I set up and did a full animal research lab. And then at that point, I got all the data that I needed for the FDA and to get my patent approved.
Nice. And
So
what product is that?
I have a double balloon colorectal catheter. It's actually the only catheter that's on the market for that use. Uh,
Okay.
so very marketable right now. We're doing great. Came out with our second generation. As you were talking earlier about investments and loans and all this, when we started off, we could not get any loans. We couldn't get any investments. Um, I end up going around and doing pitches at different medical device arena and end up I think we first round we got about $80,000 in grants from pitches,
Nice.
and that got us going to get us enough money to do some of the research. But for the big research, I needed hundreds of thousands of dollars to do that research. So I applied for an NIH grant, and we got a phase one NIH grant to fund research. The research itself took 5.5 years, so it wasn't something that happened overnight.
Wow. Oh, so
Yeah,
you
yeah.
guys are just getting to the point to where it's it's on.
Exactly, exactly. So we came out with our first product in 2019,
Okay.
uh, and then we came out with the latex version. So there's two different materials that you can use. One is latex and one is silicone. Latex is a lot cheaper and easier to make, so we came out with a cheaper one first just to test the market and to get some revenue so that we could actually move to the next phase. But when we came out in 2019, we were on the market for maybe 5 months, 6 months, and then COVID hit.
Wow.
So
Yeah.
yeah, so then the hospital shut down. All the procedures that my products were used for, they didn't even schedule those procedures. So we waited another year before we could get revenue again. And during that whole phase, when the hospitals closed down, we still had bills to pay. So
Sure.
basically, I was using my funds from my work to keep the business paid up, so we didn't go behind on anything. Um, but then after the hospital started to open back up, we started getting traction again. But then a lot of the hospitals, when they opened back up, they were so risk adverse, they were afraid of everything.
Sure.
So they didn't want to use any products that could cause any that added any risk to them. So that made us to the point where we couldn't sell our latex catheters because of latex allergy. So we lost some of our business there. So we had to go back to the drawing board again and start another R&D process, research and development process,
Sure.
where we could develop the silicon version of our product. And then we got started with that, and then we ran into another roadblock because the silicon raw material was actually the higher demand, so it was low. They couldn't find enough material at the time. I don't think it was that they couldn't find enough material. I think they didn't have enough workers to acquire the material. So the demand was there. So the way they work the process for the demand is that any product that was already on the market and getting revenue got the supply first. So that put us out for another 9 months. We couldn't get our material to do our catheter. But finally we got the material and we came out with our silicon version in December of last year.
So
And
3 months ago.
yeah, very, very new. So but December, January, our sales doubled from what it was with the latex. Because
Nice.
now we're able to acquire some of the children's hospitals that couldn't use it. So now we're bringing in the children's hospitals along with the adult hospitals. So the catheter itself is used for several procedures. It's used for intussusception reduction, which is a pediatric case where the kid's bowel telescopes upon itself. And there's two ways of treating that patient. And one of them is using our intussusception reduction procedure in radiology, where we use a catheter, a colorectal catheter, and we plug the rectum and we put air in, and the force of the air actually pushes the bowel back into position and reduces that obstruction.
Wow.
When we can't do that, then they go to the OR and they have it surgically reduced. So by doing it our way, we save the kid from any surgical procedure. We save him from any days in the hospital. Basically, after we do it, the kid goes back to the ER, maybe stay there for about 4 hours, and then they're discharged home.
And so now that you guys have it all figured out as far as the product, what is the one thing that you guys are going to focus on for, let's say, the next 6 months to double your sales or triple your sales? Or
well, right now we bring on distributors for Salesforce, so we're increasing our sales force to where we can cover all the territory, and then on top of that, we're doing a lot of email campaign. We're doing a lot of digital marketing, basically, to try to get the word out. We actually have a conference here in 2 weeks where we're going to in Texas, a radiology conference. So
okay.
we have meetings set up, face-to-face meetings with a lot of the attendings there. And then we have a presentation at 2 hospitals in Houston, Texas.
So are you a part of like a bunch of like associations and things like that? Or
Well, yeah, I kept all of my memberships that I had before.
okay.
So while I was practicing, I had all of my memberships. So when you retire, you can actually get an emeritus status. So I have emeritus status with all of my associations. So I'm membership for life, basically. So I have access to all the conferences as well. And a lot of people already know there. So it makes it easier for me to get in and make the sales pitch.
Sure. Relationships. Sometimes, like they say, it's not what you know, it's who you know. Sometimes.
Absolutely. So, and then on top of that, we have 15 residents that goes through my program at the hospital every year. So we graduate 15 people that goes out to different facilities. So with my 20-something years with 15 residents, I have a lot of people out there that I trained that'll that's respectful, and they'll reach out to me about the product. So that word of mouth is another good way of
Sure.
business as well.
And so when you were getting everything started, so you have your job and then you have the business, or do you have a practice, or how's that work?
Well, during the time of the invention, when I was doing all the research, I still was working my job full time. I just retired in 21.
Oh, congrats.
Yeah, thank you. So yeah, the whole time I have 4 children, I'm married. So juggling a lot of juggles, but getting it
Is
done.
that your wife that's involved as a COO, or who's that?
Yes, that's my wife.
Okay, nice.
Yeah. So her and I are running the entire business basically, and then we bring it on distribution centers to sell all the products. So basically, we're basically the brain here, Sealcath, and then we have all the branches out from us that's making the sales.
Now, how is that balancing? Well, the having a pretty much a business with your wife. How's that working with your wife now?
Oh man, it's great. It's great. I mean, we've done it before.
Oh, okay.
Yeah, we had a consultant business while I was working, and we would on the weekend we would teach classes, continuing education classes. So we've been working together. We've been married 28 years.
Oh, congratulations.
Yeah, yeah. So we're used to each other by now.
That's what's up. So what is you guys' plans for the next 3 to 5 years, I guess? Is it just that main focus on distributors or
Well, no, I mean, I think within the next 6 months we'll have all the distributors that we need, and then after that point, our whole focus will be traction and getting sales. Our goal is to get 15% of the market within the next 2 to 3 years. So that's our goal. So we're
and
gonna
and what would
push
that do
hard.
for your business revenue wise?
That will multiply our revenue from today's point to maybe 20 times.
Nice. And you plan on doing that, you said within the next 3 to 5 years or
2 to 3 years.
2 to 3?
Yeah, we're gonna work hard this year. This is gonna be a year where we're gonna hit the pavement a lot. I'll have digital marketing throughout the
Digital
whole US
marketing
and
as
Canada.
in what, like LinkedIn or what?
Yeah, we're doing all the social media. So we have LinkedIn, we have Instagram, Facebook, Twitter. So we'll
Would
have.
would but wouldn't you have better luck with LinkedIn than
Oh
you
yeah,
would?
we are using LinkedIn, but we'll use the other one because there's two ways that you can come at it. One way in LinkedIn is a more professional, so we hitting all the radiologists that uses it.
But then you could also hit the parents.
There you go. So
Oh, see, I see.
I'm hitting all the patients with the other one to let
Yeah,
them know that this product is available and how it's used.
I like it. Yeah, I see it.
And then patients are coming asking for the product. So you get it on both ends. The doctors want to use it, and then the patient wants it used for them. So you got to hit it both angles and get it all. That's why we scaling to try to do it in 2 to 3 years. If we were just focused on the medical profession, I don't think we would reach it. But once we start focusing on the consumer, more of those patients are coming asking for it because they understand how it works.
And they you said it prevents them from going into surgery.
Absolutely. That's for the pediatric case, but we actually have it to where one of the other applications is colon cancer screening, virtual
Okay.
colonoscopy. And that's a case that patients can come in, they can actually drive themselves. There's no anesthesia involved. PrEP is similar to the optical colonoscopy, but with this, the patient comes in, they get on the CT scanner. We plug their rectum with my catheter. We put CO2 in the colon, distends the colon, take pictures with CT scan, and then we take those images and put it through a computer software and do what we call a fly through, and we can actually look for pileups and anything else. In addition to that, we can use the plain films from the CT and look at the patient's liver, kidneys, and all those organs to make sure there's nothing wrong. So actually getting a 2-for-1 deal doing it that way. It takes 10 minutes of the patient's time. They drive themselves there, they drive back.
Wow.
It's a lot quicker. We recommend this only for patients that don't have a high family risk of colon cancer, because most patients that have a high family risk of colon cancer usually will have pileups.
Okay.
And during the procedure, you need to take those pileups out. So any patient that has a high risk, we'd recommend them going and getting an optical, the one that's already being done.
Okay.
And we work hand in hand with a GI service to where if they get to a point where they can't complete their colonoscopy, they send them to us and we complete it using the virtual colonoscopy. And if we have a patient that we scan and we see that there is pileups that needs to be removed, then we'll contact them and then they'll put the patient on the schedule and get that pileup removed.
Okay.
Yeah.
Now, with starting your business, but besides, I guess, the getting the actual product to the point to where it needed to be, what is one of the biggest hurdles that you had to get through or
Well, I
still
mean,
get
the
through?
major hurdle was finance.
Yeah, yeah,
Yeah.
the fundraising.
Yeah. So when we first started, we didn't have. I mean, I went to banks and all the banks told me no. We had some community funds where you could go to. And I spoke to them on the phone, and it's like, "Oh yeah, yeah, you invented a product. Come on in, we can definitely help you." And then I get to the door, and the guy looked at me and said, "Are you the inventor?" And
Mm.
then he went to the back and came back and said, "Oh yeah, your project doesn't fit into our scope of what we want to do." So you can tell how that works. And I got that on several occasions. When they spoke to me on the phone, they was like, "Oh yeah, we can definitely help you." And then when they see me, they change their tone. So I'm in South Carolina.
Yeah.
I'm in the South.
Have you guys looked into any CDFIs? It's like a community development fund.
Yeah, yeah, that was one of them.
Really?
Yeah, that I went to, and the guy, yeah, you know.
So the community development funds are usually they're supposed to be for serving underprivileged communities.
Absolutely, but it's all who you have in the office.
Huh? That's true. Yeah,
Yeah, that's what I thought too, and that's why I called on them because the banks wouldn't lend me any money. I was actually using my money the whole time to fund it, so I was like, "There's got to be another way to get it." So I went to the community place, and over the phone they told me, "Yeah, definitely, yeah, we can take care of you." And then when I got there, the tone changed. Um, and then we at that point I just started focusing on pitches and trying to write grant applications and do it that way. And
sure.
we got enough grant, and then we had a local research association here in South Carolina where you could pitch to them and they would give you funding. And I got 150,000 from them
Nice.
of grant money. Went to Georgia Tech when they had a pitch, and I won $10,000 there. Had a few local pitch here in South Carolina where I won 6, 7,000. So I just kept doing it that way, and just went around doing pitches and getting some money that way.
He was
And
moving.
then when the Addy pushed up to where I needed thousands of dollars, then I started doing the friends and family raise, and I got a lot of my colleagues that jumped in and put in funds. And we did basically a debt fundraiser. So we actually did a 3-year fundraiser where everyone that gave us money, we paid them back with interest in 3 years.
Nice.
So I never diluted my company. I still have all those shares.
Good. So with that being said, do you plan on at some point going, well, how is this your baby? Is this something that you want to like do for the next 20 years, or are you planning on maybe getting out in 5 years or
Well, the opportunity is always there for an exit. It all depends on the offer. I'm not in any rush. Like I said, I'm retired, so until I get the right offer, I will keep selling the product.
sure.
Uh, I'll be profitable, so it's not like I'm gonna be in the hole. So, we're not in any rush. Our goal is, I mean, if we can exit within 3 to 5 years, that'd be great. But that's not the end of the world if it doesn't happen.
I mean, but that's the beauty in doing something that you were already doing before you even retired or you're passionate about doing it. So it's like this is already what I've been doing.
Absolutely, absolutely. Well, I mean, I'm working on another project now, so exiting would be great, and that'll give me opportunity to focus on the other project.
Can you talk about that or
It's another invention. I don't have enough legal documents on it yet to elaborate too much.
okay?
But yeah, I'm gonna be for the rest of my life. I'm gonna invent medical devices and bring it out.
That's what's up.
Yes.
So would you say that that's your passion?
Yeah, my passion's always been to help patients, right?
Yeah,
So as a clinician, I helped them in another way. But now that I've retired, I've seen all of the flaws that we have that can be fixed. So my goal now is to work on the other side and fix those flaws. So our healthcare can improve in a different way.
okay. Yeah, I like that. Well, I appreciate you taking out the time.
Absolutely.
Um, you mind if I post this? This
Not at
probably
all.
be the first one I post. I have a few people in the medical field I'm connected with, few hospital CEOs and things like that. Maybe they'll see it.
Absolutely. That sounds good.
All right,
I
man. I
appreciate the
appreciate you taking
opportunity.
up the time.
No problem. Thank you.
All right. Have a good one.
Have a blessed day.